So welcome back. Today we'll be talking about hypertension, which just is a fancy way of saying that the blood that's flowing through the arteries is doing so very quickly and at a higher pressure. Imagine a calm stream that has now turned into a raging river. It will not only damage what it is going through, but also damage things on the side. It's one of the oldest diseases described in human history. The Chinese around 2600 BC described it as a hard pulse disease, and they noticed that patients who had a high salt intake, you could feel their pulse easier. The Egyptians, who had now in 1500 BC, had perfected the process of mummification when they removed the organs from a body to be mummified, the important bodies anyway. They would notice that there was a change in the heart and the brain of these patients. And in fact, in many ways, hypertension is a lot like diabetes in that it affects the smallest arteries first and the tissues around them. So the brain gets affected, the back of the eye, the heart, and the kidney, which is why people with long-standing hypertension will get more strokes, more hypertensive retinopathy, more heart attacks, and more kidney disease. And again, it's been well documented that if you can control that blood pressure earlier, you can prevent some of that long-term damage. So as the patient finds the force to lose the weight and to stop eating salt and to give up smoking and to manage their stress a little bit differently, sometimes it's better to not delay treatment for that. So hopefully this pattern, which I think is very important for patients to recognize, where a disease starts up on the inside, it does so a little bit silently, the body adjusts, different organs take a hit for the team, and now the disease becomes full-blown on the outside. But by that time, long-term damage has already taken place. And hopefully this makes better sense as far as why your doctors are trying to step in a little bit earlier and earlier. Because as Gandalf said, all we have to decide is what to do with the time that is given us.